There we go.
Okay.
Yes, I'm like, I did, but I didn't hit the record like this one. So, or like record on this computer. So I actually fixed it and now it's recording. So
Awesome. Thank you.
yeah. So, hey guys, so just so you know, I'm like, yes, like Lynn was saying, the comprehensive or the Essential for Living is very comprehensive. So we're actually going to be taking quite a few of our Skinner box meetings and like to actually keep going, like with learning about the Essential for Living assessment and curriculum. So I first of all just wanted to let you guys know that. So we're only during this training going to cover the very first part of it. So basically what we're doing during this training is in the book or in the chapters that you guys read, it actually recommended for you to do activities 1 through 4. So that's what we're going to start you guys with, is doing the activities 1 through 4, minus this session doing the alternative method of speaking, because that is also very, very comprehensive. So I think that alone is going to take a whole training session with you guys. So during our next Skinner box meeting, that is really where we're also going to put most of the focus, is on that alternative method of speaking, if that is what your client needs. But for this training session, what we're going to go over is the study guides that you guys did. And then we're going to just go over like the quick assessment part, also establishing like your learner's vocal profile. And then what you guys will do is you guys are actually going to take this wonderful Essential for Living scoring grid that Lynn has created for us, or she started to create. You guys are going to love it. And you guys are going to pick a learner or a client that you have, and you yourself are going to complete this assessment, or the beginning stages of the assessment on your client. So first of all, how many of you are familiar with the Essential for a Living? I'm like, and I mean like really fluent and really like familiar with it. Like Lauren, you are? So I'm like, I think she's done it. Yeah, a little bit. So just so you guys are aware, I am new to this too. So I've been diving into it pretty much every single night, like working on it, but I am by no means an expert or fluent with it. So for some of you guys that have done it, you know, if there's anything that I do make a mistake on or whatever, or if I label something incorrectly, please feel free to speak up and then just let me know. Because again, I'm learning along with you guys. So, but from what I'm finding out in this, it's like my brain hurt. I'm not even kidding you. It's very overwhelming. It's very intensive, but the more I dive into it, the more I'm actually starting to like it, with the very specific recommendations that he puts in here for you, especially with the alternative method of speaking. That if your client is a vocal profile too, that at this point, like, you should probably be consulting with an SLP and determining some type of alternative method of speaking for the client. So like, he pretty much lays it out in here for you with this book. So thanks, Lynn. So I just kind of wanted to make a couple of those announcements with you guys, and just, yeah, just let you know, like I said, I'm learning with you guys. If there's anything that's incorrect, please feel free to speak up. So at this point, Lynn's going to take over the first part with you guys. So thank you.
Thank you. Thank you, Tiff. I'm going to start out with a question with you guys before we dive into, or as we're diving into, the review tools for the chapters. What is different about, and you guys are free, feel free to unmute as we start talking about this. What is different about this curriculum compared to every other curriculum that we have at our disposal, or that we have in our toolbox that we're currently using across all of our programs?
It's going to teach functional skills.
And give that girl the candy bar, she wins. That's it.
I was gonna say behaviors too. It focuses more on those as well.
What was
and then it, oh, sorry. Nope. I was just gonna add that it uses like verbal operants, but not just kind of with like arbitrary milestones, more like specifically how is it going to help kids with their functional life.
Absolutely. The biggest takeaway in spending several days with Pat McGreevy, and as Tiffany and I keep discussing this, and good Lord, we've had so many discussions about this curriculum. It is unlike anything else that we have in our toolbox, but it is for that huge group of kids that a lot of us serve right now, that will be coming to us as part of this life skills program, that, you know what, a developmental curriculum is not appropriate. A solely academic-based curriculum is not appropriate. When you're 9 or 10 and you don't talk, and your day is comprised of significant behaviors of concern, and you can't let someone know that you want something to eat, or that you're hungry, or that something hurts, I don't care how many times you can write 1 to 10 in 1 minute. And that's what this is going to allow us to do. So let's get going. Enough of the sales, right? So chapter 1. Chapter 1 was that introduction kind of thing. I will ask you guys, do we want to go through every single one, or do we want to pick an area? I very much am for let's pick an area and dive deeper. But also, if we want to go through every single item, we can do that too. In chapter 1, what do we want to talk about? What do we want to dive into? What did you read and go, what?
For me, the abbreviations and wrapping my head around every abbreviation I know, and now there's a new letter for it, was really difficult.
Same.
I love Pat McGreevy. There are some things in this curriculum I just want to go, what? Why are you calling it that?
Wait till you get to the actual skills assessment part. I can't even. I think that was the most that made my brain hurt the most. That it's like you've got your minus of like SI and like all of like the different kind of like codes that go along with you doing your assessments. Wow.
I felt like I was in math class, to be
Right,
honest,
learning
and
all
like
your
I needed to
trig
solve
functions
for M, and I'm like, what?
Speaking of math, I thought that it was really funny that there's even abbreviation for math. Like,
Yes.
is adding the A really that
It's
difficult?
right that we went from math to MF. So this chart, and that's why I blew it up this way. This chart is going to be a really good friend that you're going to want to have on hand as you start to do this. As you really become familiar with EFL, there are going to be some terms that you're going to hear a lot. Need to know is a big one. In the Essential 8, there are, or actually within every category of skills, there are things that the kids need to know. There are things that are nice to know or good to know. And then there are things that are like, okay, fine, we'll get to those. But this need to know is a very important category. A lot of the, we know what the VD map is. Some of these things like the ARP, the assessment and record of progress, they're specific to the EFL. And as you, in the after, or later on this afternoon, Tiffany's got some great videos where Dr. McGreevy is going to be talking about, oh, and you open up your ARP and you do this and you do that. That's why these things are important. But all these terms, listener responses, names and directions, answers, we use these all the time. So it's just going to be a matter of understanding and remembering what the abbreviation is. Here are all the need to know skills that have need to know skills. But now we get into the meat of it. Here's the important part, the domains for essential living. These are the big 8. Another thing that sets this curriculum apart, so as you're discussing this with families, if you're discussing this with colleagues, when we say, hey, we're going to go with this curriculum, and the very first thing that sets this curriculum apart is that we have the ability to focus on really functional skills that are going to serve your loved one for a lifetime, independent of diagnosis. The other thing that sets this curriculum apart is this domain number 7 of the essential 8, and that's the problem behavior domain. You're going to take a deep dive into your kids' problem behaviors and everything that goes along with it, the intensity, the frequency, the topography, if there's medication that is involved in their care, and how does that relate. So the problem behavior domain really sets it apart. Everything that goes along with this, and Tiffany had talked about the alternative methods of speaking, not part of the essential 8, but a very critical part of this. And Tiff and I have this discussion, and the two other SLPs in here are kind of like, what do you mean alternative means of speaking? I really wish that he would have called it alternative methods of communicating.
Same.
And he and I have actually we had that discussion a little bit at the last training we did, but you know what? He's got tons of experience. So we're just going to go with his alternative means of speaking, but we're going to know that this is alternative means of communicating. So that's a third thing that sets this curriculum apart. There's not another curriculum out there that says, hey, based on the profile of your kid, here are all the different alternative forms of communicating available to you. So what else? What else do we want to, you guys tell me, what are the essential 8? Requesting, yep.
Waiting.
Yeah, the answer's right here. But it's the afternoon and we've been listening a lot today, so what else?
Tolerating
what?
Skills and behaviors.
Or the unpleasant situations.
Yeah.
Related to health and safety. That's huge.
Daily living skills.
Accepting no.
Accepting no. Right?
Removal of items.
Yep.
Activities. People.
Because none of our kids ever have any problem with that, right? Never, ever, ever. I mean, imagine if every single one of our kids had these basic skills, that we could focus on teaching them these basic functional skills without having to worry about a specific academic curriculum, a specific developmental curriculum, that we could give them the skills to make their lives a little bit easier and their parents' lives a little bit easier. That's something else that's going to separate us, and something else that this curriculum allows to have happen. Let's see what
I
else.
was really surprised when I first started diving in at, I think, some of the safety stuff, especially, that I feel like you forget about when you do just VB-MAP stuff, and just like, wow, that is such an important skill to have. Why are we not already doing this? So
right?
I really appreciated that part on top of the alternative forms of communication part as well.
Lauren, I'm so glad you brought that up, because safety skills are more than crossing the street and not touching a hot stove, and we only have so much time in our day, and we only have so much access to these kids. So we have to make sure that we are maximizing every single second of it. You know, we want them to be able to understand the steps of making their own snack. But my God, what if that means they leave hot water running and then put their hand in it? I mean, there's lots of things. Here's one that you guys are just going to want to commit to memory. So when parents ask us, why are you using this? When you are training your treatment teams, why are we using this? Because everything comes from communicating and functioning effectively in the world around you. So EFL was developed for whom? There's no answer to this one. Kids with neurological disorders, yes or no?
Yes.
Yep. Chromosomal anomalies? Yep. Congenital conditions? Your Down syndromes, your Prader-Willis. Acquired conditions? TBIs? Global developmental delays? Yeah. So we are not inhibited by diagnoses. That's the beautiful thing here. Family walks up to us and says, can you help my kid? Yeah, we're going to help them be functional. Can this curriculum be used with the blind or visually impaired? Yep. We'll have to be really clever and creative about creating appropriate stimuli. But we can do this. And Lauren, I'm gonna brag about you a little bit. Years and years ago, 100 years ago, before HTS was HTS and we were ABS, we had a kiddo who had some motor impairment, and we wanted to use PECs, but they did not have the fine motor to grab those little icons. So Lauren, in her brilliance and creativity, put those icons on blocks, on big blocks, so that that kid could grab them and then exchange the block. That's the kind of creativity that it might take when somebody has visual impairments or has motoric impairments. And that was a great modification to get that kid some quick functional communication. This curriculum cannot be used with the deaf or hearing impaired, correct? No, that's not correct. Can it be used with the deaf blind population? Yep. How about severe orthopedic impairments? Absolutely. What if somebody has really serious medical concerns, like perhaps they're trached and they require section? Can this curriculum be used with them? Of course it can. What if our kid requires frequent hospitalizations? They're immunocompromised and boy, everything puts them in the hospital. Can we use this curriculum with them? Absolutely. Think how important it would be for that kid to have an effective way to let somebody know that they don't feel well. What if the person we're treating has a terminal condition? Can this curriculum be used with them? You bet. We teach them the most functional way to engage in daily living skills. Guess what? An OT is going to be our best friend implementing that. Keep them safe. If they've got to take medication, this kind of stuff, we're going to rely really heavily on our OT friends. Let's see, what else? What else in the rest of chapter 1 do we want to jump into?
Hey, Lynn, actually, can we go over what you have pulled up right now? So
You
like
bet.
ages and like when it
You
is
betcha.
appropriate. Yeah, like to can maybe continue with the VB map, or when we should switch over to the EFL, or maybe we can do a combination of both.
Perfect, you got it.
Thanks.
So again, we talked about this curriculum being very different than anything that we've had in our toolbox so far. When we get the littles in, we're going to start with a VB map. Why? Because it's developmentally appropriate, and we want to give kids that opportunity to see, where are they? Maybe they just need really good systematic instruction in order to get them on a developmental track, and then they may be one of the kids who returns to district. If you've got up to a 7 or 8 year old and they are continuing to make progress with the VB-MAP, then guess what? We're going to continue with the VB-MAP. If you've got a 7 or 8 year old who's making little progress with the VB-MAP, and after consultation with the BCBA or an experienced teacher, what are we going to do? We're going to, and this was supposed to be a multiple choice, but we're just, here, we'll do this. When we get to the 7 or 8 year old, then guess what? We're either going to change from the developmental to a functional curriculum, or we could use both instruments for a period of time. Because if, something all of a sudden clicks, and hey, they are continuing, or they all of a sudden are making great progress in the VB-MAP, then we might be able to stick with that. But we might need to do some overlap of both until we see, where is this kid going? So if somebody's 9 or 10, they're having difficulty answering questions or participating in conversations, are not beginning to acquire academic skills at the 1st or 2nd grade level, what are we going to do?
Implement
Somebody?
EFL.
You
I like
got
the abandon all teaching strategies option.
I like that too.
like, there are only so many choices between 2 answers of either do this or continue. No, just throw your hands up, give it off. Now you have an adult-aged individual with moderate to severe disabilities, developmental or acquired, especially with limited language or no method of speaking. What are we going to do?
Use EFL.
Yeah.
Use EFL, yeah. The height of inappropriateness would be to implement a developmentally sequenced curriculum and, just meet them where they're at. Because, what 30-year-old wants to work on letter sounds? And so let's use our time wisely. What questions, what discussion do you want to bring up about these kids? These are the situations that we're going to run into the most.
Real quick, I just wanted to say, Brad, I think you are in the wrong room. You should be with group 2 or maybe 3.
Lynn, I have a question. How would you suggest we kind of like transition, I don't know, away from things like the AFLs? So I have a lot of my older kids who are 14, 15, 16. I've been using the functional skills portion of that. Do you see us using that as a support, or kind of transitioning entirely to the EFL and not really using that anymore?
So I love the AFLs. I've used it lots and lots and lots of times. I think that there's a good deal of crossover or duplication between the AFLs and the EFL. As an agency, we are using the EFL as our life skills curriculum. I think that this is probably more comprehensive and kind of directs our efforts a little better in terms of what are the priorities. And so that's why I like EFL as opposed to, or not that I don't like AFLs, but I like that component of it better. So I would say to you that, whatever those skills are that you have targeted for those folks using the AFLs, see where they fit in the EFL sequence in you know, what are the must-haves, the good-to-haves, the nice-to-haves. See where those fit, and do we need to do some changing up? And there may be component, like some of the you know, stuff that happens at house, especially some of the safety, the health and safety. There may be more specific things in the AFLs than in EFL. So I think having that knowledge and having that available to you is great. But as an agency, this is what we're going to be using with our life skills curriculum.
Could we use both, like such as if the EFLs don't have some of the stuff that we like on AFLs, especially for the kids that are like kind of on that cusp, that they're maybe still working on some of those AFL-based skills, but we want to move more towards the EFLs?
Again, I think that anything that you've identified on the AFLs as a need, it's probably going to be somewhere in the EFL. But I wouldn't say exclude either one. You know, it's gonna, whichever one you're reading at the time as you go through all those skills lists, and when you dig into the assessment, and there are what, Tiff, 2,000, 3,000 discrete skills in the EFL. There's going to be some crossover, and there's going to be some things that are left out of one or the other. So that's going to inform your practice even more.
Mm-hmm. And guys, I can pretty much say that with the assessment of functional living skills, like everything that's in there, because you know, like you have like, what is it, like 4 or 5 different books that targets like different, you know, different areas of a client's life, you know, such as like, you know, home environment versus like a group environment. Pretty much I can tell you at least what I have read thus far, and with doing the assessment, it's all in here. Like it really is all in here in one book.
I have a question, comment. Yeah. I don't know, concern's not the right word, but about that age to 7 to 8 age that, you know, a lot of us over AIC especially are treating. I know that generally, like I said, I've dabbled in this a little bit, mostly with the Essential 8. But those like at-risk kids, like I don't ever want to assume a kid's going to come in and he's going to hit a plateau. I don't want to do that, obviously. I know generally I tend to look at, have they been in therapy before? Or is this a 6-year-old kid that's had 4 years of therapy already? He's not quite the 7, 8. Maybe I want to make that switch a little early. But is there generally like any guidelines that you guys have found for like that 5 to 6 range? We are leaning more towards little to no skills. Our progress is very slow in the BBMAP, moving over a little earlier than that 7 to 8, or is it like a hard, hey, it's 7 or 8? Am I making sense, I guess?
You are making perfect sense. And I love that question. That's one of the lovely things about this curriculum. There's no hard and fast anything other than we have to teach functional skills, period. I think that all of the criteria you listed, or all of the conditions you listed, are absolutely critical to think about. And boy, one of the things that I would love to put together as we implement this is, you know what, we've got a 5-year-old and here's a profile. So you know what, we've decided to implement the EFL sooner. But we've got an 8-year-old and here's the profile. Here's an 8-year-old who has had no intervention, and this is their first time in therapy and they are just hitting targets like crazy. Then you know what, we might give them a little extra time. And I would love to come up with those profile considerations and actually share them with Dr. McGreevy and say, you know what, here's the spectrum of thought. But no, 7 or 8 is not hard and fast. It is a guideline, and it's a good line. It's a good guideline. You know, in our world, we say if a child is not functionally verbally speaking by the age of 7, the chances of them developing that skill are pretty low. You know, we're never going to say never, but it's pretty low. So we already should have been thinking about alternatives for years.
I have a
Yeah.
question. So since the EFLs have a big focus on like behaviors and like accepting removal, accepting no, being denied access, stuff like that. Can you also like say I have a kid who's 5 and they're actually doing great on ABLES and BBMAP, but they have behaviors that are still interfering and I like the way EFLs has it written, let's say. Can I still just strictly for behaviors use EFLs?
Hey, you are the driver of this treatment plan. You know, this, if the one thing that is inhibiting this child from moving forward is that they don't tolerate no, then guess what? That now becomes your most socially significant behavior to intervene on. Because everything else is going to plateau. So you can absolutely, if you've got a kid who's doing well with the developmental curriculum, except for that one thing, heck yeah, use the knowledge that you've gained from using the EFL to keep them going in it. Heck yeah.
And I was going to say too, I'm like, I think looking at like, because we have so many assessment tools within our reach, we as behavior analysts, like we have this, I'm like, in these behavior consultants or those who are pursuing certification, like we have this responsibility to always do like what is appropriate, like for our client, what's in the best interest of our client. So like Lynn was saying, I'm like, there may be, the client may be doing very well with the VB-MAP, I'm like, or even the assessment of functional living skills, like some of the things that you're targeting, but again, they're not doing well in another area, then, you know, you can bring in another assessment tool to kind of just piggyback off of the other assessment tool that you're using. So looking at what assessment tool is most appropriate for your client. And then Lauren, with yours, I wanted to say, like, I always think back to an article that I read actually when I was in school. And I think, Lauren, I don't know if you remember this or not, but I shared it, and Sam too. I shared it with you guys actually at ABS. Touch your head or make your bed. Like, which
Remember that article?
What?
I remember that article. Yeah.
Yeah, right. It was a great article in teaching basically what are those functional skills. What's going to be the most appropriate for your client, you know, based upon like their age. Like Lynn said, like they only have a very small window of skills for them to acquire. So we need to teach them the skills that are going to lead to them being most successful within their community and with their environment. So taking it back to, some of you guys remember your behavioral cusp and your pivotal behaviors. So really, really focusing on those, honing in on those, and that's what we need to focus on. And I'm like, and then basically your essential 8 that are in your essential for living, I'm like, those really are kind of like looking at your pivotal behaviors.
I know. I would love for Lynn Kogel to look at these, Lynn Kogel Pivotal Response Training, to look at these and go, hey, you just called them something else. Are we ready to move to chapter 2? To that review? All right. Close down chapter 1, chapter 2. Chapter 2 was really short and sweet, and that was nice. But I do appreciate the fact that he gave case studies. So probably the one closest to, well, these two probably, but let's go with our 7-year-old here. Severe developmental disabilities, no method of speaking, and mobile by wheelchair. Experience spastic movements on both flexion. Wow, did I spell that wrong? We'll fix that later. And extension. Flexion, I'm flexing my bicep now, I'm extending it. So when you bend an appendage or when you extend it. She inhibited very limited fine motor movement and range of motion, and only in her right arm and hand. Who's going to be one of our best friends for this case?
OT.
Yeah,
PT.
her name's Nicole in our group right now, and she's fabulous. Communication was limited to looking toward an item in her immediate environment or smiling when asked if she wanted a specific item or activity. Did anybody ever learn in school that if a child's presented with something and they smiled, that you weren't to acknowledge that, or you weren't to use that as an indication that that was something that they wanted? Becca, did you ever learn that? Hannah, did you?
I
So
don't think so.
that literally was something that I learned in undergraduate. That if you held something up and a kid smiled at it, you had no way of knowing that if they were really smiling because they liked it or if they were just smiling. And I hated that lecture, or I hated that tidbit of information. So I was very glad that it's part of this case study. She was taught to request yogurt and toy with idiosyncratic signs, and she learned to use both signs without prompts in one 20-minute session. Do we have kids, and granted, we don't have kids in wheelchairs, but do we have kids with, comorbid physical diagnoses that we have to be aware of what their body should and should not be doing?
Lynn, I had a question about this case study.
Absolutely.
So it says she has no method of speaking, but she was able to sign. So I think she does have a method.
So I don't know if you were in here when we first started, when we talked about the one thing I really wish she would have said, alternate form of communicating. Because while she may not engage in verbal speech, what she is doing is she is communicating using they taught her two very important idiosyncratic signs, and I don't care that they're idiosyncratic signs, because everybody in her environment is going to learn them, so that when she's, whatever sign they taught her for toy and whatever sign they taught her for yogurt, they're going to know that's what she wants. So yes, she is effective. She learned an effective way to communicate. It just didn't happen to be speaking.
Okay, I thought he just used speaking as communicating, like he used in her.
He uses speaking to mean communicating.
Right. Okay.
And so by the end of this 120-minute session, she went from no way of communicating that I want toy or yogurt to an effective way of indicating that she wanted toy or yogurt. Make sense? Okay. What else? Do we want to talk any more about case study or any of the other case studies, or keep going?
I just love that little summary point right under that case study. I think it's very powerful.
Right? And I will tell you, I mean, you guys who've known me for a long time, know that I'm a speech pathologist first and a behavior analyst second. And I absolutely believe with every cell in my body that everything comes from communication. And I have yet to meet, I've been doing this, it'll be 30 years next year, and I have yet to meet the individual who cannot learn to communicate in some way. It might take a while. We might have to be stinking creative about it. And it might be a very small repertoire, but I haven't ever had anybody from 3 years old or 88 years old who cannot learn to effectively communicate. And I think we need to remember this when we're working with our kids. It might not mean that they always verbally speak, but we can teach them to communicate some way. And I think that's the other reason that maybe this curriculum rang so true with me from a functional standpoint, because it is so communication heavy. You're going to hear in one of the videos later on, Dr. McGreevy talks about it all starts with the man. And I'm not going to take the thunder out of that video, but just remember that phrase. So within the curriculum, he talks about pre-speaking stages and skills. This is a really boiled down, probably, what would you say, Hannah and Becca, maybe 3 graduate classes into 5, 5 bullet points. But there are things that need to happen. You will hear in our speech world that there are no prerequisites to communication. There are. You have to have at least an understanding of cause effect, of you have to intend to communicate. Back in the day, the term was called object permanence. Like if you were playing with a baby and you had a ball in front of them, and then you had a ball in front of them, you had a ball in front of them, and then you put a blanket over the ball, would they understand that the ball is still under the blanket? Or would they think that, oh, it went away because the blanket covered it up? I think one of the cutest ways to do that is when kids cover their eyes and then they think you can't see them anymore because they can't see you. So you have to have some level of object permanence. Eye contact isn't the be all end all, but boy, you know what? You better know how to at least visually reference what's happening, so that we get a lot of information from faces, from the environment, so we better know what we're doing there. And then of course joint attention is the be all end all of it all, but we don't want to wait for those skills to emerge. You know what we do? We teach them. There's not some magic developmental wand that says these things are going to happen. So conclusions. Most children and adults are capable of functioning as effective speakers. And that, again, everything in this is from Dr. McGreevy's experience, that in order to be an effective speaker, you got to have specific motor movement or a collection of movements that can function effectively as the learner's method of speaking. Pointing, gesturing, signing, touching an icon board, touching a voice output device. And scientifically validated teaching procedures from applied behavioral analysis and Skinner's analysis of verbal behavior. That's a good place. Oh, I skipped a bullet point, sorry. That's a good place to start, because you know why? Demands are where it's at. And then there's some indication that the learner wants specific preferred items or activities. What gets them going? What makes them happy? Sound good for chapter 2? Awesome. Chapter 3.
I just wanted the speech pathologist from the first case study to go back to school. That's how I felt about that. That's all I have to say about that.
I know, right?
I was very irritated when I read that chapter, but tried to keep it to myself.
It's really hard, that there are some really amazing speech pathologists out there. Like, I think we employ them all on our team, but there are some really bad ones too, really bad ones. And so, you know what? Behaviorists have every right to be really ticked off with them. All right, so here's where we get into all the wideness of the EFL and the must-haves, the should-haves, the good-haves, the nice-to-haves. So did this make sense? Or did you look at this and go, oh my God, are these map coordinates? What are these things?
I
don't
the
get the letters
of-
and numbers.
Yeah,
Okay.
I think I got like lost in the letters and numbers, and I had a hard time like just focusing on the information, because like on the right you see all of that and you're like,
The map
what?
coordinates.
Exactly. Where am I supposed to go?
So there are, let me grab them really quickly. There are 2 books that go along with the curriculum. There's this one first, and I'll just showing it to you, but I will read it to you. Not the book, the title. This is the practitioner's handbook. And you see, I have all my little post-it notes here and all my little tags here so I can quickly go. This is your Bible, or this will be your Bible. The first 5 chapters that we sent you guys came from this. The second book is this, the Assessment and Record of Progress. So EFL is the first set of letters and numbers. So EFL 113, right here, that's where you find it in this book. ARP7 is the corresponding area of this book. That's all those mean. The important parts are, so the must-have requests and related listener responses, indications of interest in making responses in this whole crazy book, which I know you can't see. It's all right. It's just lots of grids and lots of graphs. If I go to R, and what you can't see on here, what's really nice is in the book, in the responding book, it's colored. And so request and related responses, R is blue. It's blue because in the book it's blue. And the abbreviation is R, it's R. So that remains consistent not only on your study guides, but throughout the book. So if I go to R1 through 5, it has listed R1. Items and activities are ranked from most favorite to least favorite. And so you have space to then list those important things to the kid. So that's what you need to know about all these numbers, that it corresponds to specific items in this book. So that's all you need to focus on there. But the must-haves are in bold. And those are the things that you really want to focus on first. Does the kid have R1 through 5, 6, 7, and 8, 14, 17 through 21 in terms of making requests? In terms of weighting, do they have R9? Accepting removals, making transitions, sharing and taking turns, do they have R10? If you can, if you can say a kid has all these in this domain, and Tiffany will get into this later during the Skinner box sessions. This is just the assessment and the overview. But if you can say a kid has all these must-haves after your assessment, then you can start talking about things they should have, things that are good to have, things that are nice to have. You're going to have must-haves in every domain. So the must-haves in requests and listener responses are in bold. The must-haves, listener responses, names and descriptions, listener responses, and listener responses, names and descriptions. I made sure that all the abbreviations were here so that you can start, you can see them lots of places and start connecting them to what they mean. So under domain 2, following directions related to health and safety, there are 11 items, but up here, look at how many items there are. So it's going to be different. Domain 3, answers to questions and conversations. There aren't any must-haves, but they're good, nice for questions and good to have for conversations. We're still going to assess it. Domain 4, daily living skills or daily living and related skills. So daily living skills related to health and safety, eating, drinking, and feeding, sleeping, mobility and transportation, avoiding harmful items. But that Drano looks just like my favorite blue juice. Other activities related to health and safety. So lots of items on here. If we get through all the must-haves, then the should-haves, medical procedures and medication administration. For how many of our families is going to the dentist a nightmare? There are people in this meeting right now that will be taking over a case or involved in a case or we're working just to get a kid to tolerate medical tools being put in his mouth. Why? Because there is no choice. He has to have multiple reconstructive surgeries. So this is a super socially significant behavior that we have to get in his repertoire. Domain 5, functional academic skills. We have some good to haves here. And if we can get to some academic stuff, great. Domain 6, tolerating skills and eggshells. I love that. Basically, it's, are we always walking on eggshells? What do we have to do to get this kid to be with us and everything not be the fight? Basic human interaction. You know, it's we have to teach them that, you know what, interacting with other people is a good thing. So there are must-haves. Sleeping is a must-have. Toileting is a must-have. Especially when we get to the teenage years, holy moly, bathing and personal hygiene is beyond a must-have. Chapter 10 in the book, but the problem behavior domain. They'll take a deep dive in there. We talked about a little bit. Domain 7, tool skills and component skills. Who remembers what MM, M, and IM? Motor movements. Sounds like matching. Sounds like imitation. So that's what these things are. You know what? Is that absolutely first out of the gate critical? Not so much. Because why? The man is the thing. But then if we get to the point where we can now start teaching these component skills, fantastic, let's do it. So.
Hey, Lynn, Brenna has a question.
Yes, Ms. Brenna.
Sorry, I didn't want to interrupt.
Interrupt.
So before, when you were scrolling through like the must-have, good-to-haves, is there like some crossover? Because I thought it looked like, you know, in one section, toileting was like a good-to-have, but in this one, it's like a must-to-have. You know what I mean?
I do know what you mean. Let's see, where is that? Some of, like toileting, some of the components of toileting might be a following directions. And so that might be a must-have. But then other components might be some of the finer components of toileting, like, God, this is an I don't have a good example right off the top of my head, like flushing. You know what? That's good to have. If they flush, that's good. And we can always teach that. But following the direction of let's go to the bathroom is the thing that needs to happen. We need to teach that before we teach them about flushing. Here's toileting. So should have daily living and related skills, toileting there, and then toileting down there. So this is a really important component. So after you do your assessment and you start, you know, thinking about teaching sequence, your assessment and your teaching sequence must also take into account skills across domains so that learners have a balanced skill repertoire rather than splinter skills. So if we're going to teach, if we're going to focus on toileting, so then we want to look at all those other domains that toileting might be in and what are those skills that toileting might be in so that we can start matching things up as opposed to only focusing on one domain. And then this kid has this real craggy profile where ooh, we've got everything in this. The ABLES is a good example of this, where you can get some kids that are really high on one category and then next to nothing on another category. And so they have this craggy, mountainous profile because they've got so many splinter skills. We just want to make sure that we are aware that we're working across domains and we give them a good balance of things to work on. So this is another graphic. So that page with all the abbreviations, that's going to be your friend. This graphic is also going to be your friend. And can I just tell you, this was great to recreate, let me tell you. So as the lower on this page, you're going to start here, and I don't know why that went to the other page, but this is your starting place. The lower on the page you are, the more functional the skills and the less difficult the skills. The higher you are on here, the skills are more difficult and less functional. So some of the listener requesting, just asking, indicating that you want something is a more functional and less difficult skill than writing or typing. But the way you move through this is you move across here. Here's the whole area on problem behavior. These are all the areas you're going to look at: self-injury, aggression, destructive, repetitive behavior. What is the severity? And then, are there psychoactive medications? Do we need to use protective equipment? Does this child ever had to have mechanical restraints? Have they ever had to have crisis stabilization procedures used? And then the extent to which self-restraint occurs and the extent to which the problem behavior occurs. So it's kind of it's a mini FBA inserted in all this. And then you move up and across, and you just snake. It's kind of like playing Candyland, where you go all through Candyland with all the skills. A lot of questions came up when he was providing our training. There we go. Asking about, boy, could you incorporate this stuff on IEPs and ISPs? And the answer to that was yes. And he gave several examples. There are lots and lots of examples, like 6 pages of examples in the actual EFL practitioner's book. And we've got those that you guys can always look at that, so that if somebody's asking, hey, how can I put this in an ISP, or how can I put this goal in an IEP, there's wording to do that and how it lines up with some curricular standards.
And don't forget to come to me for IEP.
Absolutely. So questions about chapter 3? Thoughts?
This reminds me of the communication matrix, Lynn.
Yes, it does. Very much so. It really does. All right, on to chapter 4. Chapter 4 makes my head hurt, only because there's now a whole bunch of more abbreviations that we have to incorporate too. So, all right, the purpose of chapter 4. The focus of chapter 4 is true or false, learning how to score items on the instrument. True. Learning how to conduct an assessment. True. Learning how to record learner progress using the Assessment and Record of Progress, the ARP manual, and the learner scoring manual. True or false? True. That is what chapter 4 is. What domains have must-have skills?
1, 2, 4, and 6.
Yep, literally the answers right next to the question. The must-have skills are also referred to what?
The essential 8.
Essential.
Yep. And those skills are what? They're
Assessed
generally
and taught.
assessed and taught first. Yep. So he's given us a roadmap of where we need to go, or where we start and where we need to go. These domains only include good to have and nice to have skills.
3, 5, and 7.
Mhm. And these skills are generally taught when learners have already acquired a substantial repertoire of
Functional skills.
Yep. That's why they're called the good to have and nice to have. We get to that after we give them what they really, really, really need. All right, so here's your third page that's going to be your really good friend. And these are the abbreviations that go along with, we're going to skip this for a second, that go along with this. And you're like, what the what the what? See how these have IA, IM, dash, SA. So think of dash as like no, not. DC, dash DC, dash RP. So if we go back up here, that's why this is going to be your friend. So IA is the initial assessment of that skill. That's just what it is, your initial assessment. IM means that you have started teaching. I'm really surprised that he didn't like just make it T, like teaching. But when Tiffany goes through scoring, you're going to see things that are like IM is in yellow, or IA is in yellow and IM is in green. Why? So that you can see what phase you're at or what stage you're at. That dash SA, dash DC, where I said think of that as not, it's the absence of self-injury or aggression. So dash SA means there's no self-injury or aggression going on. Dash DC, there's an absence of disruptive behavior or complaints. No, I don't want to. It's cold. It's too hot. No, 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 no. Those would be complaints. The absence of resistance to prompts. How many times do you have a kid where you might want to do, a tap at the elbow to get them to initiate the activity and they pull away? So this really, really drives down deep into what this kid is doing. Then we get into all the different levels of prompting, and everybody should be really familiar with this. It's just that the FP, PP, MP, and IND. In one world that might be just an I, in another world it might be I with a circle around it. In the EFL world, independent is IND. The first time I read that, I was like, dash S dash M, or line S, line M, what? It's seconds and minutes. For the PP, that's they need permanent partial assistance. APD means they need an adaptation or a prosthetic device. So, and Nicole, you feel free to jump in here if you want, but we've got kids who do not have the fine motor skills to get a nice tripod grasp on a crayon or on a pencil. So we need to modify that writing utensil by making it wider, by building it up. So that's how we can indicate that this is something that kid needs by APD. CO, critical outcome of the skill has occurred. 2E, occurrence of the skill with 2 or more examples of the same item or activity. All this will make sense when we go through how to actually score the assessment. So E is examples, S is settings, P, persons. What are these things talking about? What is this a description of?
Generalization.
Thank you. Who said that?
Cassidy.
Cassidy, you win the second candy bar of the day.
Sweet.
Yes, generalization. M, when motivating events have occurred and are strong. See, this goes back to our behavior roots. NI, the occurrence of a request when the learner doesn't have sensory contact with the requested item or activity. Wouldn't that be great when you have a kid sitting in front of you and all of a sudden they think of something that they want that isn't in their immediate environment and they ask you for it and you say, oh, do you want that now? And they can indicate that they do. How about that? And then the DET, the skill's no longer occurring consistently. So let's go through these. Not exhibiting problem behavior or resistance to prompts. What codes would you give that item? The answer is next to the question.
The absence of SA, absence of PC, and absence of RP.
Exactly. Thank you, Vince. Exhibiting the skill with less and less prompts. So what codes would you use?
FP, PP, and MP.
And what do FP, PP, and MP stand for?
Full prompt, partial prompt, and what was the last one?
Minimal physical.
Minimal physical.
Minimal, exactly. I know that you all can read, and I know you all know that the answers are right there next to the question. This is so you get used to thinking about the concept, the code that goes with it, and saying it out loud, having some experience with the item. Persons exhibiting the skill independently, without prompts and without hesitation. So not only can they do it, but they can do it with very little latency, and they can do it fluently. So what do we code it as? Yep. IND, independent.
Yep.
All right, they are exhibiting the skill for specific periods of time. How do we note that?
SM, so that's seconds and minutes.
I love whoever gave that additional explanation. Thank you. Because of physical limitations, a learner cannot perform a specific skill or one or more responses that are part of the skill without assistance. How do we code it?
PPA.
What's PPA stand for?
Permanent partial assistant.
Oh, love it. Thank you. When learners require an environmental adaptation or prosthetic device to perform a skill, what's the code?
ADP.
APD, and that stands for?
Adaptation or prosthetic device.
Yeah.
Absolutely. Thank you. Thank you. When the
Hey, Lynn.
critical, yeah.
I have a question about this.
Okay.
So I know we're going to get to AAC devices eventually, but are we going to use that for that code if kids use devices to communicate?
I don't know if that came up. I don't.
Because if the skill is requesting something, but they don't do it verbally, they use their communication device to do that. Is that a adaptation, or we just know that that's the way the child communicates?
You know what? I'd have to go back and look at the items that would be assessed, and where does there's a whole section on alternative method of speaking.
Because I'm just thinking about our kiddos specifically, like at Newmarket, we have a couple kiddos where like sometimes they use their device and sometimes they use verbal output. I'm just
There is,
curious.
sorry, if I could answer your question. So that kind of goes along like within the vocal profile. So looking at kind of like what is their primary method of communicating? I use communicating, Lynn. I'm like, but that's okay, right? I'm like, but that's okay because they may also have a backup as well. So depending upon where they fit within that vocal profile. So, and it tells you like if they're a 4 or a 3 or they're a 2 or a 1, it even tells you like you can focus on still working on words, like verbal words, but have some type of backup mode of communication for the child.
Okay. Thank you. I was just curious.
Nope. It's a good question. And I did not have the answer. When the critical or most important outcome of a skill has occurred, what's the code?
CO.
CO.
You got it. CO, critical outcome. Exhibiting that skill in situations other than those in which it was originally taught. So what are all those generalization codes?
2E, 2S, 2P.
Right, and 2E, 2S, 2P mean what? To environments, to
Settings.
to settings, yep.
Yeah. And
Two people.
or more people.
People.
2 or more people. Yeah, guys, you know this. Go back
Yeah,
to
we
your
do.
roots. Go back to your generalization roots.
Yeah.
What
You're
do
gonna
they
hear back-
outline what the difference is between like an environment versus a setting?
Yes, they do. And
Okay.
you'll learn all about that.
All right. All right.
All right.
Here it says for 2E, 2 or more examples of the same item or activity.
Examples, yeah, not environments. Yep. So can you put your shoes on when you're getting ready to leave your house? And can you put your shoes on when you're leaving physical therapy and it's time to go?
Could that also be like you can put your tennis shoes on and you can put your boots on?
Right.
Okay.
There you go.
Awesome.
So then what are we talking about? Or if you see the little less than and greater than, that's an indicator right here. This is an indicator of motivation. So something is less motivating or more motivating. And then the NI is when they request and they don't have sensory contact with the item. So all of these are that generalization and carryover kind of concepts. And then a previously acquired skill is no longer occurring consistently. Maintenance has not occurred. What's that code?
DET.
DET. And those are the things that make us cry.
It is nice that they include that though, because if you think
right?
Yeah.
You can't
Exactly.
really notate that.
Yeah, I feel like that's one of the biggest things that some assessments are missing. Like you pick up with a VB map for a kid who like hasn't had services in 9 months. How do I indicate that like they don't have this even though it's filled out from their VB map last time?
Yes.
Yep. Tiffany, I'm going to ask you, do you mind picking up? I need to step off for just a minute. Would you want me to stop screen sharing?
Well, let's see. I'm like,
I would say, can you control it because you're the host?
I think so. Let me see. No, actually, I can't control it.
All right, let's see. Let me do
Lynn,
this.
I think you can give Tiffany access to control your screen.
Give her a remote control, Lynn, and it should work.
Stop your screen sharing. Remote control. Tiffany Waltz. There, you should be able to do it now, Tiff.
No, I was gonna say, I'm like, I can, but like what you have with the PowerPoint, I can't be, or wait, can I? Is this me? No, like I can't because it's on your computer. Like I can't scroll it up.
Oh, okay. I just pulled this. I just pulled this from the shared drive.
Yep.
Okay.
I can. Yes, I can pull it up.
Okay. Guys, I'm really sorry. I do need to step away for just a second. It might be more than a second, but I will be back.
All right, guys. Sorry. Let me pull this up really quick for you guys.
Tiff, would it be possible to take a quick break while you're pulling it up?
Actually, yeah, I was just thinking about that. If you guys want to take a few minutes, take about, well, technically, yeah, go ahead and take till about 2 o'clock and then we'll start back up.
Oh, I didn't know y'all heard me.
Vince, go take a break.
Oh, no, let me get out of here.
Go take a break.
Tiff, I can jump back in now. That's
Okay.
fine.
That's fine.
Yep. Thank you.
Oh, okay. I'll have to I'll have to stop sharing mine so you can switch over to yours so you can control the screen.
Sounds good. All right, we ready to hi-ho cheerio, get moving on? All right, so let's talk about the problem behavior domain, because this is definitely something new to our toolbox and definitely a codified way of, or I guess a generalized way of codifying what we're observing in terms of problem behavior. So performance, come on, little cursor. Performance is measured by the type. So SIB, we all know that's pretty common abbreviation. AGG, what's that?
Aggression.
Aggression. DES and DIS.
Property destruction and disruptive behaviors.
Love it. Somebody's got their little table right in front of them. And REP.
Repetitive.
Repetitive, yep. And then we also talk about the intensity. Severe, moderate, mild, that's pretty standard. Along with, and this, I don't know of any other curriculum that has this as part of their assessment, but the extent to which psychoactive medications are used. And when we get to the med portion, you're going to be like, wow. But we've got medication. MR is what?
Mechanical restraints.
Thank you. PE is?
Protective equipment.
You got it. CS?
Crisis stabilization and procedures.
You got an SR?
Self-restraint.
Self-restraint, exactly. So the form of the problem behavior is defined by a precise description of the movements a learner makes from the start to the end of an instance. That should not be surprising to anybody. Everything we do needs to be objective and observable. Absolutely. So if someone is engaging in an interruption in the ongoing activities of the child or adult, which severe behavior code would we use?
REP.
Repetitive.
Yes.
Physical harm to that child or adult.
SIB, self-injury.
SIB. And you notice that one is physical harm to that child, so that they're doing it to themselves. So that's SIB. Interruption in the onion activities. Oh, wow. Interruption in the other activities of other children or adults.
Disruptive.
Exactly.
Onions
Physical
are
harm.
really important to treatment, Lynn.
I'm sorry? Onions
Onions
are
are really important to treatment.
They absolutely.
We can't disrupt the onions.
Maybe if your name is, or your initials are JE.
Onion school.
Physical harm to another person.
Aggression.
Aggression. Thank you. And then property damage or destruction. What would that code be?
DES.
DES, destructive. Very good. All right, now let's talk about the intensity. Movements of a learner that have resulted or could result in minor injuries to that learner or others. Mild, moderate, severe.
Moderate.
Very good. Movements of a learner that have not resulted in injuries to that learner or others. If, however, these movements become more forceful or occurred over an extended period of time, minor or self-serious injuries could begin to occur. Mild, moderate, severe. Mild.
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 And then finally, movements of a learner that have resulted or could result in serious injuries to that learner or others requiring medical attention and in some cases resulting in permanent impairment.
Severe.
Severe.
Severe. Very good.
Hey,
All right.
Lynn.
Yes.
Sorry, are you able to like zoom in the screen to make the words a little bit bigger for everybody?
I can try. Let's see.
Sorry, I have old eyes.
I know, right? There we
How
go.
about this?
Pulled it up on the study
Sitting
guide.
there going,
I couldn't read it either.
Yeah, same.
I'm
Thank
sorry.
you.
All right. So now, remember when I said when we get to the medication area, you're going to be like, what? So these are all the codes for meds. So the most straightforward one is that dash or absence of no medications. So if kids not on any psychoactive meds, then that of course would be the code. But then look at our choices here. One with some reduction in dosage, or just one psychoactive med. One psychoactive med with some increase in dosage. So do you see how this goes hand in hand with the need for a revision or an update on the ISP, or on with the ISP from our mental health folks, that if we find out that a kid has been on a med that the dosage has reduced or has increased, that's going to be something that we want to make sure that we share with them so that that can be updated on the ISP. Then we have descriptions about 2 psychoactive meds, and then has there been a reduction, they're on the meds and nothing has changed, or there's been some increase in dosage. Again, all these things are very important to know about medications. And then finally, are they on 3 or more psychoactive meds? And we've got kids who are on 3 or even more than 3. And that's a lot of meds for some of these little bodies. So we want to make sure that we know what they are. We want to make sure that we are consulting with our mental health team and doing research to find out what are these medications, what do they treat, what are the side effects, so that if we all of a sudden, there are meds where seizures are a side effect. And so if all of a sudden we have a kid that we start seeing seizure activity, we want to make sure that we talk to somebody. Is this a med side effect or is this a new medical problem? And having this as part of this curriculum really makes this curriculum stand out and is a unique component to the assessment. So this area is about the use of protective equipment and mechanical restraint. And again, you can really tease this out. How many times has protective equipment needed to be used? How many times has a mechanical restraint needed to be used? How has it been faded? Has it been faded? Has it ever been required? Has it not ever been required? MR, mechanical restraint, PE, protective equipment. We have kids that, we need staff who need to have access to arm guards,
Okay.
you know, those sorts of things. We have kids who, now you're going to hear my dog bark because the doorbell just rang. We have
Mine's
kids
barking
who, we have kids who need to wear helmets because headbanging behavior is so significant. So we need to make sure that we are appropriately recording the incidents and the use of that equipment. We have kids, we don't have any right now. I have had kids in my professional past who have had to wear helmets because they have drop seizure activity. So they can be cruising right along, and then the next thing you know, they're on the floor. The last thing you want to do is not have that child's protective equipment, that helmet on their head, because that would be really bad. And we need to know that those things are there and it's incorporated in your assessment. I love that. Then the use of crisis and stabilization procedures. Are they used at all? How often are they used? That can help us prioritize that, you know what, there are components of this problem behavior that we need to get a handle on. You know, we're using crisis stabilization procedures more than 5 hours per week. Okay, we need to take a long, hard look at what this kid needs. What do we need to do with this treatment plan? And what do we need to do to help this kid be successful? We've got those kids. We've got those kids on caseloads right now. Same thing with self-restraint. And somebody might be asking, okay, so like what is self-restraint? Think of the kids who pull their arms up in their sleeves and then don't interact with things, that they've got a toy in each hand. Well, if you've got a toy in each hand, then guess what? You can't interact with other toys and things around you. So that is what that category of self-restraint is referring to. So again, how do we characterize it? It doesn't happen. Okay, if it does happen, how often? Is it fading? Is it increasing? And then for all of the problem behaviors, we also have a frequency designation that we can talk about. So, you know, if something, you know, if you've got two behaviors that you're looking at, two problem behaviors that you've identified, and one happens less than once per month, and one happens 20 to 50 times a day, which one you gonna, in general, there are always exceptions. Which one are you going to address? Of course, the 20 to 50 times per day. And this is part of the assessment. It's not like you now, you know, you have to do a separate behavioral assessment. It's all right there for you. So chapter 4 is long. So here's the section on conducting an assessment. So how do you get started? And it's laid out for you. It's these 4 activities. And again, Tiffany's going to go through this in more detail. So we're going to go over this, but not go deeply into it. So you're going to complete the quick assessment. She's going to talk to you about the quick assessment. Determine the learner's vocal profile. You're going to go through what are the must-have skills and note possible skill deficits. This is your starting point. And then you'll confirm and determine the extent of the skill deficits that you've pulled from activity 1 and activity 3. This is where to find the information, what your codes are, if they exhibit certain things, if they don't exhibit certain things. This is going to be another one of your pages to keep on hand, so that as you start your assessment and you start learning how to do this, you have this right with you. And then this is a sample of a scoring sheet. So if a learner responds without self-injurious, aggressive, or destructive behavior, mark without SA, without SA. Without disruptive behavior or complaining, mark without DC, without DC. Or without resisting prompts, mark without RP, RP. So you're assessing. The child requests 10 highly preferred snack foods or drinks, non-food items or activities that can be made frequently and immediately available. So for this kid, and this is responding 7, or requesting 7, sorry, requesting 7. This kiddo, they love cookies more than anything. IA, what's IA mean?
You started
Something-
your assessment.
It's in the initial assessment, exactly.
Okay.
Your initial assessment is in progress because IM means that you've initiated targeting, you're working on it.
Yep.
So this is your initial assessment stuff. And that's why it's color coded like that. These are just additional items. So recognizing items, cup. They did it without any negative behavior. They could do it with all of these prompts. Oh, they did it independent. Look at that. And they did it independently in with 2 examples. So look how far this kid is on this. Now you're like,
You
why
have to
did you?
color all of that if they are independent with it?
You go through it because if you tested or assessed
If you actually
at
tested
each
it,
level,
okay.
and Tiffany will go into that
And
in
there was
greater.
success.
Now you look at that and you go, why did you just throw in another color? You hate me? Again, the color, look at, what did yellow mean? Or what did IM mean? Initial what? What phase are you in?
Assessment.
Initial assessment,
Oh,
exactly.
that was IA.
Yes, IA is initial assessment.
Okay.
So if it's yellow, then all the subsequent yellow codes or yellow boxes mean that happened during your initial assessment. Now you're in treatment.
Okay.
You're in green. And so for this skill, using the word cookie in your treatment, what you've targeted, now you're here. That's
Are
what the
those
colors mean.
standard colors?
Okay.
I'm sorry?
Are those like the standard colors?
They are the colors that everybody from EFL has used. So you're going to see later on that we are just adapting these as the standard colors. That why reinvent the wheel? That's what folks that's what folks with EFL are used to using. So why not go with them? All right, so let's go through this quick review. So descriptive assessment. Note responses of, I jumped a little too far. When you do the assessment, you are going to talk to people who know this child really well. It could be a parent, it could be a teacher. It's the same thing we do with a lot of our assessments. You need to conduct an interview for some of these items with someone who knows the child well. So during that descriptive assessment, that term should be very familiar to our behaviors here. Note responses of interviewees to what?
The essential 8.
The essential 8. In the essential for living quick assessment. And that's the first thing you guys are going to do, the quick assessment. What are you conducting by observing the learner?
Descriptive assessment.
Descriptive assessment.
Thank you. If observation is not feasible, conduct a more detailed what? With a parent, residential manager, instructor, care provider, work supervisor.
Interview.
Interview, exactly. So now I'd like you to define instances or episodes of each of the problem behaviors. So self-injurious is, what are they
To
doing?
self.
Injury to self, aggression or aggressive, sorry.
Injury to somebody else.
Injury to others.
Destructive, DES.
Destruction of property.
Injury to property.
Disruptive, DIS.
Interrupting activities of others.
Excellent. And then REP, repetitive.
Behaviors that like, interfere.
For example.
Interfere with completing like tasks or activities.
So what would an example of a behavior be that we would code REP, repetitive?
A client that has a repetitive hand flapping.
Very good. What's another one?
Vocalization.
Could be.
Repetitive speech.
Yep.
Toe walking.
Toe walking, very good.
Mouthing.
Love it, love it, love it, love it, love it, love it. Record what kind of medication on a problem behavior, direct observation and interview form?
Psychoactive.
Medications.
This is an example of the problem behavior, direct observation and interview form. So everything, this is how you're going to record when you're doing the observation, when there are problem behaviors in this kiddo's repertoire. You can see medication-wise, they're on Risperdal and Tenex. So guess what? When we come down here, then we're gonna have to code all the medications here. We're gonna dive way deeper into this as we go through the assessment. Again, remember, this is just an overview. I don't
All
want to
these
spend
acronyms are hurting my head.
I know they are, which is why we're gonna go, I'm scrolling right past it.
I need flashcards.
Right. Important thing to take away, the last thing we're going to go through on this chapter is when you are actually in treatment with a kid and because you're like, oh my God, do I have to do this coding and take this data on every single time I present this kid with an item? And the answer is no. You take data on the first opportunity of the day. So you present whatever item it is, whatever skill it is that you are working on, and whatever they do that is your data for that skill for the day. Now you can teach and you can take your data that, oh hey, this is great, we needed less prompting, or oh crud, we needed more prompting, or problem behavior increase, that sort of thing. But in terms of graphing, first probe, first opportunity of the day, what does this look like? You start here, and then you go up here, and then up here, and up here. What's this look like?
A positive trend line.
Yeah, upward trend.
A positive trend line that you would see on what? If you were graphing behavior. So this is a self-graphing data sheet. And this actually is called a self-graphing data sheet. It was adopted, I forget where they adopted it from. He talks about it. But why do all your pluses and minuses and all your prompting level and then take that and then plug it into another chart and then have to share that chart when you could just pull up your data from your first probe of the day and then you see what the kid's doing? Wahoo. And you can look at that and see that kid's improving, right? Again, this is just a different variation of, this is a weighting. So how's this kid doing with weighting? Just very quickly by visual inspection.
He's waiting for a longer duration.
He is. What did he start at?
0 seconds.
And now what's he at?
20.
Look at that. Here is our code, and these are the colors that we are going to use. So during the initial assessment, it's going to be yellow. Changes in performance level during kind of the first period. So we could use this as the first 6-month period after assessment will be green. Changes in performance levels during the second 6-month period. Those will be in red, but these are the standard colors we're going to use. Yellow assessment, first period green, second period red. And now you see how that looks all charted out.
Lynn, I have a question.
Absolutely.
And maybe Tiffany's going to go over this later when we do the data and stuff like that. But if you could scroll up to the one that looked like a graph. So should we be probing them that many days on that same skill? Because I know like with ABLES and stuff, you usually only assess it pretty quickly in that moment. And then you wait until maybe your 6 months or other observations, but you don't like keep filling it out every time.
We will go into all of the implementing the treatment, that sort of stuff in more detail as we transfer the continued training into the Skinner box session. So you bet. All right, that's chapter 4. Tiffany, I'm going to ask you a question. Do we want to go through the chapter 5 review, or do you want to go ahead and jump into your stuff because we've got an hour left?
Oh, is that it?
Yeah.
Actually, can you scroll down a little bit, Lynn? Let me see.
Yeah.
Okay, that's just the activities. Okay, keep scrolling. Okay, that's still the assessment part. Keep scrolling. Still the other full assessment. Keep scrolling. Let me see. Okay, I don't need that. Really that. Keep scrolling. Oh wait, that's the same one.
Let me pull up 5.
I was like, wait, hold on. I was like, I think chapter 5 should actually be the quick assessment.
Yeah, it should be the quick assessment.
Lynn, I just have to say that all your tabs is giving me a panic attack.
Oh man.
Becca says the very same thing. Welcome to my life.
I feel better about mine now.
Actually, it might be, we don't have to review the whole thing, but it might be good to just, like, we don't have to do like the matching the correct, like, we don't have to worry about that one. And then, that's just the chart for them to reference. So maybe just the first couple at the top, because it's not that long, like it's like just like on basic information about the quick assessment, and then I can hop in and then go over the whole quick assessment with them.
Perfect. All right. So let's do our true and false. It is advisable to begin an assessment by using the essential for quick living. Oh my God, I promise goodness. I can talk. The essential for living quick assessment if the learner has severe fine motor deficits.
True.
I forgot to put the answers on that one. Sorry.
That's true.
The learner exhibits severe forms of self-injurious behavior.
True.
True.
The learner has splinter skills in the VB MAP assessment.
True.
True.
The learner has severe forms of aggression.
Definitely true.
True.
The learner has destructive behavior.
True.
Yep. There is not a kid that this is not workable for. The interview actively is designated to suggest deficits in what and what?
Functional skills and problem behaviors.
Correct. The extent of which can later be confirmed by what and what?
Correct observation.
Correct observation and assessment.
Exactly. So your quick assessment is really just that. It's a quick assessment of a handful of skills across the essential 8 domains to get you started. Because then you can always go back into the 3,000 plus other skills. Do we want to go through each of the domains, Tiff, or do you want me to show them the data sheet that's in Excel?
Vince, I'm dying.
So I'm just looking at all
I was gonna, sorry, it's on mute. Yeah, we can jump into the quick assessment, the actual quick assessment part, and then they can review that on their own. So
All right. Let's go to because it's so blown up. There we go. So this is this. There's a great feature on the ESL website where you can put everything into their scoring tool, and it is a great scoring tool. It's really expensive, and it's a per kid per year cost. So I started just recreating it in Sheets. So as Tiffany goes through this, you're like, I don't know, spoken words, what's 1, what's 2, what's 3, what's 4? When you hover over each domain, then it gives you what is 4, what is 3, what is 2, what is 1. Same thing here. And you can alternative methods of speaking. Tiffany, I'm going to stop screen sharing, and it is now all yours.
You're muted, Tiffany.
I'm sitting here talking. Apparently, I need a brain break because I forgot to turn my mute off. So
Do we need to take a couple minute
I was
break?
like, do you guys need like a 5-minute brain break after all of that? Yeah. Yeah. All right. Why don't you guys take like a 5-minute break, go to the bathroom, whatever, and then we'll just jump into the quick assessment part of it. Sound good?
Perfect. Thank
All
you.
right.
I just read that Christopher Plummer died.
Who?
The dad in Sound of Music.
Oh, oh.
I know, right?
When? When did he die, Lisa?
Oh, sorry. He was 91. It was this morning.
Gotcha. Oh.
I literally just watched The Sound of Music over the weekend.
I always loved his character in that movie, you know?
Yeah.
All right, guys, let's get through this. We are almost done. Okay, so here we have right now, and then I'll bring up for you guys too, the web EFL that Lynn was talking about too, because I actually started one on a client, so you can kind of see an example of how to do the quick assessment. So, all right, so here we will start with your spoken words right here. So trying to determine what is my client verbal, or do they need some type of alternative methods of speaking? But for this, we're not going to go over that because I told you guys that it is pretty extensive. We're going to go over that in our next Skinner box meeting. But for right now, we'll just go in here to the spoken word section to determine, okay, what is the scoring criteria for my learner? So actually, if you guys scroll down here too, or if you click down here where it says Q&A descriptions, Lynn has it spelled out for you guys, like broken down for what the scoring criteria is for each skill set. So if we look here, the first one for spoken words, this is the extent to which learner exhibits spontaneous, understandable spoken words and the conditions under which spoken word repetitions occur. So when McGreevy talks about conditions and talking about spoken words, it's whether those words are controlled or if they're uncontrolled. So looking at your learners, you know, especially the ones that maybe have echolalia. So you might have to look at if those words are under your instructional control or discriminative control. So looking at your scoring criteria for this, you have number 4, which is exhibits many spontaneous spoken words, nearly typical spoken word interactions and spoken word repetitions when asked to do so, all of which are understandable. So what does that mean to you guys as far as a 4 goes?
Verbal.
Highly communicative.
Mm-hmm.
Expresses wants and needs and.
Yep, exactly. Like pretty verbal, able to request for what they want or need. And it could be, you know, with items within sight or out of sight, but their communicative behaviors are pretty reliable. And like you can actually understand what it is that they're asking for. Number 3, exhibits a few spontaneous spoken words and spoken words repetition, both of which are understandable. What does this mean to you guys?
Kids who can do, you know, some preferred items, have brief phrases, you know, they might request in 1 to 2 words, kind of prompt dependent sometimes.
Yep. And these are also to think about your kiddos that have echoics. So if your child is able to, or your learner is able to imitate most of the words that you give them, and they may not request for items as much, but if they have those echoic skills in their repertoire, then that would be a number 3. Exhibits occasional words or spoken word repetitions, but neither are understandable. What does this mean?
Most likely a novel person would not be able to understand that request.
Right. And then they don't have, there's no echoics in their repertoire. Like you might still be working on echoics with them. You might be working on, you know, just like getting letter sounds in their repertoire. So those would be your learners where you would score it as a number 2. And then number 1, exhibits only noises and sounds. That one's pretty self-explanatory, right? If you have clients that they only do noises or they only produce the same sounds, and those can be repetitive sounds over and over and over again, then your scoring criteria for that would be number 1.
Tiffany, would we score these like similar to other assessments, kind of relatively conservative? Because I can think of like, I feel like most of my clients are somewhere in like a 2.5, where like, you know, they can echo reliably, but a lot of times they just scream instead, or have like very, very limited spontaneous communication. But when they do spontaneously request, it is understandable.
Okay.
So would you say like score a 2 if it's really not effective?
I would score it as a number 3, because here's why. Like, is the screaming like is it more of like looking at that as a problem behavior? Like, is it like disruptive at that point? Like, is it like, are they screaming to get their wants or their needs met? So whether it's to get out of a task or get access to something, specifically for that learner. But if they have the echoics that are in their repertoire and most of those words are understandable, and can they do at least a few of spontaneous spoken words, like requesting for their wants and their needs, then I would score that as a 3. Does that answer your question?
Mm-hmm.
Okay, yeah. So then the screaming, I might look into assessing that more as a problem behavior. All right, so going back to then your quick assessment. So all you're gonna do is you're gonna click on here, which is nice. Is your learner a 1, a 2, a 3, or a 4? So now, when you are doing this, when you are doing the quick assessment, you know, it's not quite like the VB map. So let's say you're interviewing someone, or you might be interviewing a couple of people. You might be interviewing a parent, and maybe you're interviewing a grandparent too. And mom says to you, well, he only exhibits occasional words. But then grandma says, oh, because we all know this happens. Grandma says to me, I'm like, oh, I hear him speak words all the time. And all of them are like understandable. You can actually score both of these on here. So you could do a 2 and you could do a 3. So one of these is like a report from grandma, and one of these is a report from mom. So now this is again where you're saying, like, once you've done the quick assessment to confirm your results that you have from this, you'll want to go in and do a direct observation of the client, especially if you're not really familiar or too familiar with that client, and you're doing only the interview portion of it, and you've got 2 conflicting responses here from parent and then grandma. Score both of these, go in, do your direct observation to do a confirmation of where they are.
I have a question.
Yes.
So like, what if their skills differ in settings? I know I have a client who at school is very, very verbal, but at home it's very limited. Would you still check multiple boxes like you would across people, or I guess how would you score that?
Yeah, that you can, and then do again like the same thing, like a confirmation. If you're able to do like an observation of the home, just to see what the client is like there. If you're not able to do that, then I would just do it based off of where you have the most interaction with your learner. All right, so we'll say, oh, sorry, go ahead.
Sorry, kind of along what Hallie was just talking about, if like in the interview, a parent says, oh, they talk all the time, like I hear them say different words, but then when you do your observation, if that's not what you're seeing, do you then score based off of your observation or still from the interview?
Then at that point, same thing. It's like where you would have the most interaction with the client, where you're going to think about the most reliable data. So if you're pretty familiar with your client and you know, like here at the center, like they've never, like here at the center, like they only make noises, right? And then I'm like, okay, a 1, like I know they only make noises here at the center, but mom reports at home, like they say like words. And again, you're not able to observe that in the home. You have the most interaction at the center, then score it as a 1. If you're able to get a direct observation in the home and you're like, oh, wow, I see my client who actually will do spoken words in the home. Where is that child having an issue? What skill area?
Generalization.
Yeah, right. Generalization. Like obviously, like they're not generalizing their man's into another environment. So looking at then at that point, I've observed in the home that they can do it, but they don't do it at the center, then I might score it as a 2. That exhibits occasional words or spoken word repetitions, but neither are understandable. If they're not understandable, if they are understandable, maybe, again, this is hard. So looking at the client who exhibits a few spontaneous spoken words and spoke word repetitions, both are which understandable. So if they have a few that they're doing at home and they are understandable, then they scored as a 3. But again, then we're looking at a generalization issue.
I have a quick question, Tiffany.
Mm-hmm.
This is a quick assessment, and based off of like our chapter reviews, there's that generalization kind of piece when you're doing the assessment. Is that something like we would go back, like make note of and go back and fill in so we can plan for that in our treatment?
Yes, and we'll get to that. We'll actually get to that the assessment, because when you're doing the quick assessment, what you're going to do is when you're doing these, you're going to make note of where the skill deficits are. So within the manual, once you start scoring these in the manual, it's going to tell you, okay, well, they've scored here. So here are all of the deficits that this learner still has, which is actually going to help you then develop the goals for your learner. All right, so once you've done the spoken words area, you're going to move to, depending on if you're 2, you would go to then an alternative methods of speaking. But again, that's in our next Skinner box training. Here we have your making requests. Sorry, I'm going to go back over here because it's so small. All right, so making requests. So do they make requests for at least 10 or more preferred items or activities without prompts using an effective method of speaking? So this could also be, you know, if they're using AAC devices or if they're using a picture exchange communication system, doesn't matter. If they already have that and they're using it, can they make a request for 10 or more preferred items or activities?
Tiff, I have a question kind of based on what Shelby brought up in the comments, and she was saying, like, you know, we've all had these kids that may use approximations of words that novel people don't necessarily understand. And I'm wondering, would you still consider that an effective method of speaking if not everyone can understand what they're requesting for?
Yes, and we'll actually get into that too when we get to alternative methods of speaking, because McGreevy there is a ton of them. There is a ton of them that he has, from you know, textual pictures to, I don't know if you guys are familiar with the Big Mac button. Like the Big Mac button can also be a form of communication or an alternative method of speaking for the learner. It could be, yes, like, you know, sound approximations of words. And then within that, he actually gets into guidelines of where you should go, depending upon what the learner's vocal profile is. So depending upon what the learner's vocal profile is, he might recommend for you to continue working on spoken words. Whereas other areas of the vocal profile, he gets into, okay, well, you should probably concentrate on an alternative method of speaking for that learner. So we will actually get into that in our next Skinner's Box meeting when we start going into more of like the alternative methods of speaking.
Hey, Tiffany, what if your like clients, I don't have this issue often, but I have like 1 or 2 clients that maybe this could apply to. They have no issue requesting once for what they have, but unfortunately they don't have like 10 or more preferred items or activities. Like they only like these 5 set things. Like we've tried pairing and everything, and it's just not the same as those 5 things. Can you still like kind of consider that and be like, well, they can do those 5, no issues. They just don't have 10 that we can work on right now?
So then that's where I would still, it's like, what is reliable? So, so if they have 5 that's in their repertoire, it's not quite the 10, even if they have 5 based off of his scoring criteria, that this person or this learner can still reliably request for at least 1 to 3 preferred items, right? So they can do 5. So we know for sure they can do 1 to 3 reliably. So then I would score that as a 3. Because your learner hasn't met the criteria for number 4, which is 10, but they have certainly met the requirements for number 3, which is making requests for 1 to 3 preferred items or activities with or without prompt. So that actually is important too for you guys to note that it can be it can be with or without prompts. So if your learner is using a picture exchange communication system and you have to gesture, okay, and then they hand the icon over to you, still counts. If you say candy to them and they say candy and then you give them a piece of candy, still counts. It can be with or without prompts. So number 2 then is makes requests by leading others to items. So maybe at this point you have a learner where you haven't established an alternative method of speaking yet. They don't have any echoics in their repertoire, but they're able to take you to something that they want. They grab your hand, lead you over. Then this would be scored as a number 2, makes requests by leading others to items. And then, Shelby, back to what you were saying too. So your kiddo who has those words, right? But sometimes will scream, or maybe even quite often will scream for their wants and their needs. Then for making requests, I would score that as a 1. Maybe makes requests by exhibiting problem behavior.
Would you score multiple? Like, would this be one where you might check both of those boxes? Because he can definitely request more than 3 items, especially with prompts, but he definitely also exhibits problem behavior. So would I check 1 and 3?
What's more consistent?
Probably problem behavior.
Okay, so then I would score that as a 1. Like whatever. Whichever one is more consistent, like that you're seeing, then that's what I would score it as. All right, so if we go back here, oops, sorry, let's go back to our quick assessment. Shelby, we'll do your kiddo. We'll score 1 here. Since we scream for what we want or we need. All right. So now, going on, before we go on, to the weighting portion, guys, what are these skills? Do you guys remember what these are all called?
Must-haves.
Yeah, these are your must-haves, right? So these are all the skills that you are going to want to start with your learner. These are your must-haves. All right, so you're weighting. We go back to now you're weighting, right? All right. The tendency to wait when access to items or activities is delayed after a request. So number 4, scoring criteria is waits for 20 minutes without complaints. Nice. Number 3 is waits for 5 minutes without complaints. Number 2 is waits for 1 minute with complaints or other minor disruptions. Number 1 exhibits problem behavior when access is delayed for a few seconds. So again, if you have a learner who is, okay, well, they can't do 20 minutes quite yet, but they can do 10 minutes, where would you score it?
Three.
Yeah, and why would you score it as 3?
Because you wouldn't want to score at a 4 if they're not fully at that 20 minutes.
Right,
You're
but
over, you're like assuming they have that skill and then you're not going to plan for it in your treatment.
Right, exactly. And I'm like, if they're able to do 10 minutes, they can reliably do 5 minutes, right? Without complaints. Like that's pretty much a given. So then yes, you would score it as a 3.
Tiffany, I have a question. For purposes of this assessment, do we care what the behavior looks like during the wait, or are they able to engage in something else, or are we expecting them like to wait, do nothing?
That's a good question.
Because I can't go 20 minutes.
Who can? We're just sitting there. Think about, again, taking it back to what is functional. Is it functional? So, you have a kiddo who comes over and requests for a piece of candy and you tell them to wait. Like, do you expect them to sit down in their chair and wait for you to give them a piece of candy for 20 minutes without complaining? No, because I know I would. Like, this sucks. I'm like, you're going to have me sit in this chair and look at you and wait for this piece of candy? No, it's fine if they do other activities, like while they're waiting for it. I mean, the biggest thing is with what you're assessing here is, can they actually wait without hitting you or hitting themselves or, engaging in some type of like crying or like whining or like falling out of their chairs. So look at like those disruptive behaviors or look at those aggressive behaviors or any disruptive behaviors. So look at those, like, can they actually wait for those items without engaging in all of those other behaviors?
Tiff, I have a quick question to go on, kind of piggybacking, because we're going to use this with such a range of ages, like starting out potentially at age 7. Like, does it break down within the assessment as you go through, like, what's typical for a 7-year-old to wait? Like, it doesn't, because I feel like 20 minutes is not for a 7-year-old at times to wait without complaining.
Yeah, this is not a developmental assessment. So again, going back to what we learned, I am like, it is not developmental, it is functional. So again, yes, you are correct. Looking at, a 4-year-old, if we're working with a 4-year-old, like, do we actually expect a 4-year-old to wait for like 20 minutes without complaints? As they get older, and especially like those school-aged kids, when you're getting into the 7-year-old and the 8-year-olds, like, they should be pretty close to that, if not at that. Like, Glenn, correct me if I'm wrong. Like, oh, you're on mute.
Yep, I just realized that. No, you're absolutely fine. And you're absolutely right. Remember, this is all about what's functional. So you do this assessment and you know what? The 4-year-old shouldn't be expected to wait more than 5 minutes. So they get a 3. You know what? That's great. Move on to your next skill. You know that's not something you're going to target. Now, if the 4-year-old can only sit there for a minute, now your intervention bells and whistles should go off. But this is all about function.
Right. Yeah. Because what's functionally appropriate for their age, that's socially appropriate too for that age range.
Exactly.
Yes.
You got it.
All right. So going back to waiting, we'll score that one as a 2. Okay, your next one is accepting removals, making transitions, sharing and taking turns. The tendency to accept the removal of preferred items and activities by persons in authority or peers. to make transitions from preferred activities to non-preferred ones, and to share and take turns with preferred ones. All right, so scoring criteria, looking at number 4, accepts the removal of items and activities, transitions, shares, and takes turns without complaints. Again, can they do all of these things without engaging in any of those like disruptive or aggressive or self-injurious behaviors? Or falling out of their chairs or like crying. So number 3, complaints when preferred items or activities are removed during transitions or when required to share or take turns, but only when motivating events are strong. So those would be like those things that it's like when you have preferred items and, you know, there's a really strong EO, establishing operation, that is in play right there. And then they might start to whine a little bit for that item. Then that would be a number 3. Number 2, makes complaints when preferred items or activities are removed during transitions or during required sharing or taking turns. Okay, so this is when they might whine a little bit, start to cry when you're taking away preferred items or activities from them, or during your transitions or during required sharing or taking turns. So again, this is the only difference with 2 and 3 is there isn't a strong establishing operation that's in play there. Number 1, exhibits problem behavior when preferred items or activities are removed during transitions or during required sharing or taking turns. So again, this is where you have if they are aggressive, or they're self-injurious or they're disruptive when you remove preferred items or activities. Or if it's during transitions, or if it's any time that they are required to share or take turns with others.
What's kind of the line between like complaints and problem behavior when you're dealing with like negative vocalizations? Because I mean, I have some kids who, like, if you were to take something away, they might not do anything like aggress towards you, but they're going to be, you know, swearing at you and narrating, you know, all the terrible things they're going to do to you. But like, it's a verbal complaint, but also kind of a problem behavior because it's not appropriate for a 13-year-old to do that in the middle of his class.
Right. So I would say, again, take it back to look at this, the significance of the problem behavior. How often does it occur? If it's pretty consistent and like that's something that you're targeting with them, then it would be 1. That would be problem behavior. And if it's very, very disruptive, then that's problem behavior and you would score it as a 1. But if it's just kind of occasional, it's like you take something away and, you know, they drop a swear word like here and there, but it's not really like consistent, then you can score that as a 2, as such as like making complaints. So I would say take it back to how significant is the behavior? How often is it occurring?
Sounds good. Thank you.
Hmm.
Sorry. Sounds good.
All right. So number 4 is completing 10 consecutive brief previously acquired tasks. The tendency to complete brief previously acquired tasks between opportunities to make requests. All right. So are they able to complete 10 or more consecutive brief previously acquired tasks of varying durations and requiring varying degrees of effort without complaints? So looking at skills that they have in their repertoire already, what are those mastered skills and can they do a 10 of them? And those 10 tasks like could range anywhere from like taking them 30 seconds to complete to maybe a worksheet of taking 5 minutes to complete. So can they do all of those tasks without complaining? So number 3 is completing anywhere from 4 to 6. So if you've got a kiddo that can do 5 of them, great. He falls into that number 3. So now this one, number 3 and below is different than number 4. So it doesn't specify that it has to have varying durations or varying degrees of effort. So with number 3, all it is can they complete 4 to 6 consecutive, so back to back, previously acquired tasks. So those mastered skills without complaints. Number 2, completes 1 to 3 consecutive brief previously acquired tasks without disruptive behavior. So now again, this is where it kind of gets into like, well, what constitutes a complaint and what constitutes disruptive behavior. So looking at, when they make these complaints, is it disruptive to those that are around him? If it is, then you would score it as a 2. All right. Now, Shelby asked, would you consider a task to be like one discrete trial or run program with discrete trial training? Oh, good question, Shelby.
Tiffany, wouldn't a task be just that, a task, putting a puzzle together, put your shoes on and tie them? So not something in our clinical setting, but something that is in the child's previously learned repertoire.
It is. So looking at, like, if you were working on a puzzle, absolutely, like they would complete a whole entire puzzle. But if you were working on receptive language, like identifying body parts or something, and you're like, oh, okay, like touch your nose, and then they did that, like, then is that
Yeah, I'm thinking like I have a client who we're trying to build just like general demand tolerance. So we're literally working up from like tolerating 1 discrete trial to 2 to 3 to 4, but it's literally like it's mastered demands, it's imitation and receptive instructions. But like, is that a task or is that one like trial? I don't know.
I'm going to say, look at, and I would say too, and like, I'm like, so you're working on trying to build that up, like that tolerance, right? Why? Because does he engage in problem behavior when you present demands?
Oh yeah.
Yeah. So here you go. Because if not, like you've already put that intervention into place, like if not, and you're going to score it as 4 to 6, it's going to look like, especially if you're doing like touch your nose and you have that intervention in place, it's going to look like your learner can actually do more than they can, because once they get to 10, you're going to move on to the should have skills within this domain right here. So if that's an intervention that you've already put into place for him to help work on that, then I'm going to say, I'm like, and it's due to problem behavior, then pretty much exhibit problem behavior when directed to complete a brief and previously acquired task. So this would be basically in the absence of any problem behavior or disruptive behavior at all. And I guess it could be then, like Lynn was saying, at that point, if it's like you're working on DTT and you say, okay, touch your nose, show me waving, do what I do, go here. I'm like, then, and they do it without any complaints or disruptive behaviors, then score it as then like, okay, they're able to do at least 4 to consecutive brief previously acquired tasks without complaints. So this is actually one of the things that Len and I were talking about. And I think Brittany, you were in it too. Like as I was going through the manual, one of the things that I think that I had the most difficulty with is it's kind of like the questions that you have too, Shelby, that it's like, well, what does that mean without complaints? I'm like, or what is 4 to 6 consecutive brief previously acquired tasks? But I think looking at it as, can they do, like with these skills, like do they perform them consistently? Look at the overall big picture. Like, can your learner do these skills consistently? So I think what was helpful for me is when I started looking at that, looking at that bigger picture and taking my learner skills that they're currently exhibiting into account, and like whether or not they're doing it consistently or not doing it consistently, helped make it a little bit easier to score on this.
I have a question, Tiffany, or comment as well.
Mm-hmm.
So when we're scoring some of these, coming at it from the fact that this is like functional skills, right? Our goal is that we have individuals that can complete certain tasks independently. Should we be coming at it that way? So where you were saying like not touch your nose, make the bed, that article you're reading, if I'm looking at this, maybe it's not the discrete trials looking at, but the vacuum in the living room, you know what I mean? Like whatever it may be.
Yes, like
So
more of those
tasks
functional
might have
skills.
more
Yes.
steps to them than just one. Okay.
Yes.
Yeah, that makes a lot of sense,
Yep,
Lauren.
good point, Lauren. Yes. So looking at it as, I mean, and maybe, with a lot of our, daily living skills, things like that we have that are broken down into, you have your task analysis, or you're teaching a whole behavior chain. It's not necessarily the responses that are in that behavior chain, such as like vacuuming, like going to plug it in, turning it on, things like that, but looking at the whole entire chain, like, can they vacuum? Can they perform all responses within that behavior chain, consistently, like doing it without complaining or disruptive behavior? All right. So good questions, guys. All right. So, guys, we have about 15 minutes left. So, all right. So accepting no. So the tendency to accept no when access to items or activities is denied, following requests that were taught and requests for dangerous items and activities that were not taught. So number 4, readily accepts no by continuing with ongoing activities. So if you tell the learner, they say, I want this, and you tell them not right now, do they accept that? Do they go back to doing what they're doing, or, maybe they go off and they select another activity? So number 3, complains only when motivation related to the requested item or activity is strong. So again, that's when you have your very strong establishing operation in play there. Number 2, complains when told no. So do they complain when you tell them, no, not right now, you can't have that? Or number 1, do they exhibit problem behavior when they are told no? All right. Any questions on that area? Nope. All right. So 6, following directions related to health and safety. So this is the domain where are they able to follow directions? So not can they complete them, because that's a completely different domain. Like, can they follow the directions related to health and safety? So following all directions that involve matters of health and safety and can taken anywhere with minimal supervision. All right, so can somebody give me an example of something that might be considered following a direction related to health and safety?
Just following safety cues, just being able to stop before walking into a street.
Okay, good. Sorry, Lauren, what'd you say?
I was just saying, I read this as can take them to the grocery store, walk through the parking lot into the store, and they're not gonna bolt in the parking lot and get hit by a car. They're gonna follow directions to walk on the sidewalk. I might be off base, but that's what I look at.
Nope, exactly.
They could call 911 if they needed to.
Yes. So looking at not necessarily, well, that would fall under that would probably fall more under completing a daily living skill related to health and safety. So looking at a lot of like Lauren was saying, like those safety cues out in the environment too. So not necessarily, following directions like verbally, but do they see, they come to a crosswalk and then they see the little red man that comes up, right, that says don't walk. Do they know what that means? Do they know oh, I see that little red man that's blinking right now, that means to not walk?
Would this also include following routines for fire drills and tornado drills and stuff like that?
That would probably, yes, because if you think about it, you are like, they have directions, like you've given them verbal directions as far as like what to do, where to go within if a fire drill happens or a tornado. So yes, that would fall under following directions related to health and safety as well. So now sorry, somebody else have something to say?
I was just say things like put your glasses on.
Yep.
Leave your hearing aid in.
Yep.
We've got a few of those friends.
Yep. All right. So, and number 4 is, can they do this with minimal supervision? So this means maybe someone is with them whenever they're out, but they're not, maybe someone is actually just taking them to the grocery store, or just taking them out into the community, and that's about it. Number 3 is follows many directions related to health and safety and can be taken most places in a group of 3 with 1 supervisor. So can they go with peers or other adults that maybe are with them, and then there's only 1 supervisor? Can they follow only a few directions and require hands-on supervision at all times? So this would be your learner who needs their handheld, but they can complete a few of the directions that you tell them to when it relates to health and safety. And do they not follow any directions that involves matters of safety and cannot be taken most places within the community without problem behavior or risking safety?
Would number 2 for that one be kind of like they need to be one-on-one with somebody?
Which one?
For for 6?
Yes.
Would number 2 be like they need to be one-on-one?
Yes. Okay. And then number 1 would be like, you can't really take them out into the community at all because of, again, like severe problem behavior or disruptive behavior. Now 7, completing daily living skills related to health and safety. So completes most daily living skills related to health and safety. So what would be some examples of this where you're actually completing daily living skills related to health and safety?
Handling knives.
Handling knives, yep.
Taking medicine.
Taking medicine, good.
Using the stove.
Using the stove. I'm liking using the stove safely.
Taking a shower.
Taking a shower. Brushing your teeth. What else?
Menstrual care.
Yep. Menstrual care.
Shaving.
Following COVID protocols.
Yes, following COVID protocols. Yes, exactly.
Taking your medication that's in food and not just swallowing the food and spitting out the med.
Yep.
My dog needs help with that one.
Agreed, Chelsea.
Natural peanut butter.
Yeah. Yes.
My dog just licks the peanut butter off.
Oh, all right. So for this one, number 4, can they complete most of these things related to health and safety? Number 3, can they complete 4 to 6 daily living skills? Can they do at least 4 to 6 of those things? Can they complete 1 to 3? And again, do they not complete any of them related to health and safety without prompts, resistance to prompts, or problem behavior? All right. And last one in the Central 8 here is your tolerating situations related to health and safety. So this is the tendency to tolerate unpleasant situations which have an immediate impact on the health and safety of the learner. What are some examples of these? This is a huge one for our kids that I can think of.
Waiting in the waiting room.
Wait, sorry, I had 2 people talking at one time. Sorry. So wait, who said waiting? In like the waiting room?
I said like being able to stay in the doctor's office waiting room. until it's time to go in.
Okay, yep, good. And then somebody else shouted out an answer. What was the
I
other one?
said like participating in fire drills.
Yep. Yep. So being able, like, once they've gotten out to wherever they're supposed to go, like, can they tolerate the situation that they're outside of the building and then waiting with other people?
Maybe like tolerating first aid on like scrapes or injuries.
Yep.
Yeah, like getting shots.
Yep. Good.
Getting their temperature taken.
Yep. Temperature taken.
Dentist.
Yes, that's the one I was thinking about. Going to the dentist. I don't know how many of the kids I've worked with that you cannot take them to the dentist. They absolutely hate it.
Big one right now is the doctors. Oh, sorry. I'm thinking my daughter specifically, the doctors have to wear masks and face shields when you go to a doctor's appointment, like being able to tolerate being around people that have all the equipment on because it's kind of scary.
Yep. Yep, exactly.
I was gonna say maybe haircuts could also qualify as like being health related.
I was gonna say the same thing.
Yeah, I was gonna ask that because it's kind of a hygiene thing.
Yeah. Yeah. So tolerating like those haircuts.
Would you also include age appropriate sexual behavior? So like if a person's starting to masturbate, that they agree to go to their room rather than the living room?
Yeah.
I mean, for some people, it's a routine to masturbate,
yes,
I think.
Yes. And then I think of also too, one specific client that Chelsea and I shared that would actually do it out in public. So, you know, that could actually turn into a safety concern too, because of, you know, people, strangers that are out there, things like that. So, so yeah, that could absolutely.
Or just even with that same client, just like going up to random people, particularly those with blonde hair, and just touching them and not being allowed to do that.
Yeah. Yes. So I'm just trying to think though. So I guess tolerating that situation would be like, yeah, like, is he understanding of that like if you tell him like personal space, things like that, like does he tolerate that? So yes. Yep.
Yeah, I feel like stranger related stuff is definitely an issue of safety.
Yep, exactly.
Wearing a bike helmet before you can ride a bike.
Yes, good one. Yep, wearing a bike or a helmet before you get on a bike. Good.
What about being around animals and pets or strange animals?
Yep, good one.
Tolerating seatbelts and staying in the
Good, great one. Yeah, Vince.
That's a good
Tolerating
one, Vince.
seatbelts. Yes. What about riding a bus? Like certain situations, like if they go out into the community and they get on a bus, like there are situations that they need to be tolerant of that, you know, well, prior to COVID, just someone might sit down next to them on the bus. So being able to tolerate that situation of someone sitting right next to them on the bus, because that might happen. All right, so looking at your scoring criteria, so tolerates most routine activities related to health and safety without problem behavior. Tolerates 4 to 6 routine activities related to health and safety. Tolerates 1 to 3 routine activities related to health and safety with some complaints or problem behavior. Or number 1, because of intense episodes of problem behavior, instructors and care providers occasionally avoid routine activities related to health and safety. All right. All right, so any questions, guys, with those areas? All right, so because we are actually down to 2 minutes, I wanted to have you guys break out to do this, or actually just get off and then come back after you do this. But I'm just going to go ahead and give you guys your assignment for our next Skinner box. So assignment number 1 is I want you to think about all of your clients that you have. All right. And I want you to think about whether or not based off of what we have learned so far, is the Essential for Living something that you feel like would benefit your clients? Okay, based off of what we've gone over so far, what you have learned. Okay, so that's number one. Think about all your clients, think about what clients would benefit them, or the Essential for Living would benefit them. Okay. So number two is I want you to then complete your quick assessment here based off of what we've went over. You don't have to worry about this section down here yet. Just do your Essential 8 right here, and then also your spoken words. Okay.
Is this shared in the drive?
What's that? Yes. So I'm actually glad you brought that up. So actually it's on your professional development day schedule too, guys, for you to click on that. But when you do it and when you complete it, please make a copy. So like download it and make a copy so we don't like have everybody's clients on here and then it keeps changing. So make a copy for the ones that you do. And then for our next Skinner Box meeting, what I would like for you to do is bring back at least one client that you have done the quick assessment on and has at least you've determined they're at a 2 or a 1 as far as their vocal profile, or sorry, as far as spoken words are concerned. Because then what we're going to do is we're going to take that client and then we're going to go into the actual vocal profiles and then determining the alternative method of speaking for them. Okay, so now if you actually have learners though, like let's say that you're working with learners or your clients that aren't at a 2 or a 1, but maybe they have a 4 or a 3, that's okay. Still do one and bring it back with you to the next Skinner Box meeting, because what we're going to talk about is we're going to talk about your assessment results that you guys did, and then kind of troubleshoot if there's anything that you ran into that was hard for you. So now at this point, you don't really have to do the direct observation. Just think about your client, but you can do the direct observation to confirm what you've done with the assessment. All right, so that's it. So do you guys have any questions about your assignment? No, you guys are good? So again, just start your quick assessment here, and next Skinner Box meeting in 2 weeks, I'm like bring your learners back with either a 1 or a 2, or if you don't have any, that's okay. If they're a 4 or 3, that's fine. Still bring them, and we'll go over the results. Sound good?
Should we do the quick assessment on every single client though that is appropriate for it, or just one? Or
yeah,
okay.
You could start that, but at least by the next Skinner Box meeting, at least have one fully finished that you can bring with you that we can review. And then we will jump into, like I said, we'll jump into the vocal profiles and the alternative methods of speaking. Sound good? All right, guys, I know your brains are probably fried at this point. It is 3:32 right now. Sorry, I kept you guys 2 minutes over. So thank you guys for attending the training. I hope you guys learned a lot and you aren't too brain fried.
Tiffany and Lynn, today was great, very informative and well planned. Thank you so much.
Oh, thank you guys.
Thank you.
I appreciate it a lot. I'm excited about it.
That's great to hear. Oh, I'm so glad. So actually, we will be sending you out. Well, everybody will be getting a feedback form too on today's professional development day. So ideas, things like that you have like for future trainings would be greatly appreciated.
We'll also send a certificate of attendance, and Tiffany and I are looking into, we're looking at what our status is with the BACB as a CE provider. So stay tuned with that. This one may or may not be able to have CEs attached, but moving forward, if we are not current with our provider status, then we will make sure that we do become current with our provider status, so that as we do these, we can have CEs attached to them. And for the non-BCBAs, specifically SLPs, OTs, you guys can use these as related for your state licensure.
Lynn, speaking of CEs, Tiffany and I still have not gotten ours.
No, I got mine. Did you not get yours?
What?
Yes.
Okay, let's stop the recording.
Sorry. Oh, yes.
For
Oh, which by the way, too, I actually,